Hello, it's Shelby from Turn Sounds. Put your socks on before your shoes. Hi, I'm Shelby. I'm a clinical exercise physiologist.
And I'm Abbey, a clinical nutritionist. And this is the Move Your Mind podcast,
where we talk all things diet, exercise and well-being and back it up with evidence
from our Bachelor of Health Science degrees. So welcome and let's get into it.
Welcome back to the Move Your Mind podcast.
Hello, hello.
Is that an exciting intro?
Yes.
Good.
We're also watching, the other night, Big Bang Theory.
Yeah.
And Sheldon said, when Thomas Edison created the telephone, he said, answer with ahoy.
Uh-huh. Yes.
I don't know if that's true.
The Hamish and Andy podcast, that's their preferred greeting, ahoy, because of that story.
Oh.
Yeah, so if you ever talk to them, you should say ahoy.
I'd love to talk to Hamish and Andy.
Me too, yeah. Oh, we should collaborate. We should have them on there.
What would they say? Okay. Anyway, what's the episode today?
So we teased a couple of episodes back now about your nutrition business going live.
Yes.
And it since has. It's up and running.
Mm-hmm.
So I wanted you to tell our listeners a little bit about that and expand on that. And then I was wondering also, obviously I've told you this because you prepared, but also I wanted to know kind of the differences between nutritionist and dietitian, because for a long time I could never remember which one you were, and then I got it in my head which one you were going to be. Yeah. And I feel like people don't know the difference. I didn't really know what the difference was. Mm-hmm. I kind of see each one bag out the other as far as you're not good, I'm good, you're not good. So kind of an elaboration on what a nutritionist is. Are you different to a dietitian? And what should we be looking out for if we want to see someone to help us with our diet?
Cool.
Like we can at Abbey Renae Nutrition.
Of course, we'll get to that. Slow it down. But it is a pretty big question. What is a nutritionist? What is a dietitian? Yeah. Why aren't you a dietitian? Aren't they the best? Blah, 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 blah. Yeah. As a disclaimer, I don't want to bag out anyone at all. No. In any profession, people are good at different things. Qualifications are directed towards certain purposes. And dietitians are great at some things that us nutritionists can't do. And I believe as a clinical nutritionist, I have some expertise that maybe a dietitian might not have. Yeah.
And even two people with the title of nutritionist can be different.
Completely.
It doesn't really say much about their ability, what their label is either. So,
Maybe
absolutely.
I'll start off with that actually.
Cool, all right.
Because, one of the biggest issues, in my opinion, with being a nutritionist is that our title isn't regulated by law at all. Okay. So you can get someone that calls themselves a nutritionist that has done a 6-month course online or has done a small diploma, or someone like me, I can be a nutritionist and I've done a 3-year Bachelor of Health Science. Yeah. So unfortunately, to call yourself a nutritionist, there's no governing body that says you can or you can't. Mm-hmm. You can do what you want. Mm-hmm. Whereas a dietitian, they are very selective and their title is regulated heavily. So if someone's a dietitian, they've completed the required Bachelor of Health Science and a Master's in Dietetics, and that's just that. Cool. Which is amazing for their profession. Absolutely. And well deserved.
Yes, exactly.
Pretty much.
Or you can assume that if you're a dietitian, you've done 5 years of some study. Yeah. Which is a nice kind of grounding, I guess.
Yeah, and I guess you could even compare it to your profession too, like an exercise physiologist versus maybe a personal trainer. Yeah. I know they're very different. Or more so
exercise scientist. So a Bachelor of Exercise and Health Science compared to a PT. One can be done in 6 months. Some of the courses are 6 weeks versus a 3-year bachelor degree. Mm-hmm. Yeah.
And that's where the kind of issue lies for myself. Mm-hmm. But the good thing is what to look for, I guess, when you're wanting to see a nutritionist is there are some governing bodies like Australian Natural Therapists Association, so ANTA, or NSA, which is the Nutrition Society of Australia. Mm-hmm. And they require a Bachelor of Health Science degree for registration. Nice. So that's something I've done personally to kind of protect my name, I
Absolutely.
guess, and let people know that I'm qualified. I've done a bachelor's degree, so I'm registered as a practitioner under ANTA.
Yeah, nice. So, yeah, when I write my name out in emails or whatever, I have my name and then the letters following it saying that I'm accredited with this certain governing body.
Yes.
Is that similar? So you'd want to see kind of those credentials in their, like, business card or whatever?
Yeah. So, like a Bachelor of Health Science, like BSc, or accredited practicing nutritionist, or unqualified is a bit vague. Yeah, so I'd say accredited is a good one.
Yeah.
And the good thing is that the organisations like ANTA or NSA, they have like a directory where you can find accredited nutritionists.
Yeah, nice.
And then with a dietitian, of course, they have Dietitians Association of Australia, and they have their own separate directory.
Nice, yeah.
So that's a really good tool to have if you're looking for a nutrition professional or a dietitian. Have a look at the accredited sites and look for qualifications.
Yeah.
Because, I mean, I've seen 101 nutritionists on social media and I'm like, what are you doing?
What grounds do you have to say the things you're saying?
Yes. Speaking of grounds to say the things you're saying,
good segue.
Good segue. Yeah, both dietitians and I'm gonna call myself a clinical nutritionist. That's what I call myself because I have a Bachelor of Health Science.
Absolutely.
So clinical nutritionists and dietitians both practice evidence-based medicine.
Yep.
So a common misconception is that nutritionists are not evidence-based, which can be true because if you do a 6-month nutrition diploma, you don't go into research, you don't go into ways to decipher evidence and make appropriate recommendations. But yeah, with the clinical nutritionist, we both practice evidence-based medicine, and we both have the same focus of using diet and nutrition to improve someone's health and well-being, I guess. But there are differences in the amount of time that we spend doing our degree and the kind of environment in which we can work or the environments in which we have more experience in. So when you're a dietitian, that's a master's degree in Western Australia. I'm pretty sure it's Australia-wide, it's a master's degree. So that's usually 5 years to become a dietitian. So you do 3 years like undergrad in nutrition, like Bachelor of Health Science in Nutrition, and then it's a graduate entry into 2 more years of dietetics. So 5-year degree to be a dietitian. My degree, it was 3 years. So then you could have the argument, I guess, that I'm less qualified than a dietitian, which if you equate time taken to do a degree as qualification level, then yes, that's very true. But then
that's not true. That's not a true claim to make.
No, because then you've got to consider what were you doing during that time.
Exactly.
So where I studied, we did 6 units in a semester, whereas other places that do the dietetics or nutrition do 3 to 4 units in a semester. So we just crammed more in. So we've technically done the units that we need to do. But in a shorter period. And then I guess in terms of qualification as well, then you've got to look at where you're qualified to work. So I feel
scope of practice.
So I feel like dietitians, they do clinical placement for the second half of their last year. And they do a placement in like food preparation. They do one in just general clinical practice in a hospital, and they do a public health placement. So they do 3 different types. So they do have a wider scope of where they can work, whereas where I studied, I did clinical placement in just a private clinic. So in that sense, I'm not qualified to work in a hospital environment, and I'm less qualified to work in a public health setting because I've done less hours. And that's completely fine.
You have less experience coming out.
But in terms of private clinical practice, and in terms of private clinical practice, where I've always seen myself and where my passion lies, so that's like one-on-one consultations, even things like going out and being contracted to certain areas to do talks or things like that. A
little bit more freedom in how much time you can spend with each client as well.
Definitely. I'd say, I'm quite highly qualified with that. I mean,
because you did how many 300 hours?
300 plus hours of supervised clinical practice over 1.5 years.
Yes. Yeah.
So that's when it does grind my gears a little bit when people say, well, you're not as qualified. It's like, well, in what?
Exactly. What are you looking at? Yeah,
yes,
exactly. Yeah.
Because don't put me in a hospital. That's beyond my scope of practice. I wouldn't do that. Yeah. But come see me for a one-on-one consult. I can work with you. I can work with chronic disease. That's what I've been trained to do. I did units in pathophysiology, in pharmacology. I can work with people on medications, disease processes. We did all that. Did like nutrition physiology research units where we learn how to decipher evidence, which is, you guys have heard me talk about that on end, so I hope I can do that.
Touching on that as well, like the fact that you call yourself a clinical nutritionist versus a nutritionist, like I'm a clinical exercise physiologist. I think that clinical word encapsulates chronic disease pretty nicely.
Completely.
Like if you're a clinical something, it means you can work in clinical settings, which is the unhealthy population, or the disease and injuries and stuff like that. So I think the fact that you can claim clinical nutritionist, kind of the title allows for a broader scope within that element anyway. Yeah.
And that's exactly why I like to call myself that, because people will hear nutritionist and be like, weight loss meal plans.
Exactly. Versus the 6-month thing. Exactly.
And then a dietitian can be like, oh, okay, you're the ones that work with type 2 diabetes and cardiovascular disease. Yeah. But no, clinical nutritionist can do both.
Can and should as well.
And that's actually where my passion lies, in chronic disease.
We're quite similar in that regard.
Yes, definitely. Yeah. Not that I don't like doing meal plans or just generalized health advice. It's super rewarding. I've always been like, I don't want to do a meal plan. Like I want to work with someone with type 2 diabetes or something like that. Yeah. But even my first 2 weeks of practice, I'm like, oh, okay, I don't mind a meal plan.
You can make lots of change. Because even the healthy population needs help, especially if they're coming to see you. So absolutely, why not use your knowledge to help them?
And it's an awesome place to start too, to see people enjoy the way that you tell them to eat. Yep. And then my tactic is always to, start off with a meal plan for like 1 or 2 weeks, get habits going, get healthy foods into people, allow them to realize what they enjoy, what they don't enjoy. And then after that, kind of go more the educational standpoint, like, okay, this is what you did. Do you understand why you did it? How can you adapt it into your own lifestyle so you don't need me to tell you what to eat all the time?
Yes.
Because, lots of places will just survive on giving people meal plans because they know that they will come back.
You have to come back in a month for a new one. Yeah.
And my goal is at the end of the day for people to not need to see me anymore.
I think that's a really important attribute to see in your clinician. Like most allied, do you fall under allied health?
Yes.
Yeah. So any kind of allied health professional that you're seeing, I think that the long-term strategy should be self-management.
Completely.
Don't keep going to someone who's like, yep, and in 6 weeks you're going to come back, and in 6 weeks you're going to come back, or whatever it might be.
Yeah. I must say it's hard running my own business. That's something that I have to think about. I'm like, you can't give everyone everything on the first consult, Abby, because
it's not a good business strategy.
You are not going to earn enough money to survive.
There are not that many people in Perth to keep a new person coming every day of every week. Absolutely.
Yeah, so that's something, my first few clients actually, when I asked for payment, transfer me the amount of money for the consult, I'm like, I hope that's okay. And they're like, yes, it's okay. And I'm like, oh, okay. Because it's just a passion, and I've just been giving out advice and things for free just for the love of making people feel better. Yeah. So that's something I'm going to have to wrap my head around.
Absolutely.
Just the value of my time and the degree. I guess people aren't paying for just the session. They're paying for the 4 years of study.
And the hours you spent prepping and going to use, doing their meal plan and whatever.
Yeah.
Yeah, there's time spent outside of the session.
Yes.
On them.
Yeah. So do you have, what are any questions that you've heard about dietitians versus nutritionists? Anything I
think, so a lot of what I've heard seems that dietitians are more restrictive in their plan, in their prescriptions, versus nutritionists maybe being a little bit more holistic and open to kind of fitting into the client's lifestyle.
Yeah.
Whereas dietitians, I've heard, and again, sorry, I've seen neither, so this is all just anecdotal people telling me, dietitians might have more of a cookie cutter that you have to fit into, where the nutritionist is happy to like mold around what you want. Yeah. Where does that sit in what you know? Because you told me once, I think the dietitian has to follow the Australian nutritional guidelines, whereas
generally
you don't have that much
governing.
Governing.
Yeah. Restriction.
So how's that work?
I'd agree with that, but I don't think. Once again, I'm not trying to sit here and say, oh, well, dietitians don't know. No. They just give people the guide to healthy eating and send them on their way.
Yeah.
I think it's just the way they are trained to be. Like dietitians, they're more involved in like tertiary healthcare. So that's kind of, you've got your primary, which is general GP, like your first port of call with the healthcare system.
Yep.
And then you've got secondary, which is like more specialists, like endocrinologists, which work with hormones, or cardiologists, which work with the cardiovascular system.
Mm-hmm.
And then you've got tertiary, which is like when you're hospitalized and it's kind of specialized acute care for a condition.
Okay.
So that's why dietitians, I think, are a bit more cookie cutter, because they have a condition that they're working with. There's certain protocols that need to be followed, so they must go from A to B. It's black and white.
Yeah.
You have this, I know what to do for this, I'm going to do it.
Especially in acute care for whatever it is that they're dealing with. You need to follow this kind of ABC type thing. Yep.
Whereas me being a clinical nutritionist, I'd put myself in more of like the primary or secondary healthcare category, which is either someone's first point of contact with the healthcare system or someone, I guess I could be called a specialist in some aspect because I'm a dietary specialist.
And you can get so I more do like primary, you don't need a referral to see, versus secondary, you'd need a referral to go see them.
Yes,
and
that makes sense.
Both of us can have both entry points available.
Yeah, so that's why I think nutritionists or clinical nutritionists have more freedom, because in primary care, you have the ability to kind of work with very new diagnoses. So you can work with other professionals, either GPs or things like that, to kind of work out the primary healthcare plan. So then I've got a lot more freedom, so I can look at what's going on in their body and be like, this is what I would do. Yeah. What do you think? Whereas a dietitian, they already know exactly what needs to be done because they're at the hospital level and they have an A to B process.
Exactly.
Whereas that's actually why I chose not to go with dietetics, because for one, I didn't see myself working in hospital. Yep. And for two, I really enjoy the diagnosis and the kind of brainstorming and the experimentation of what you can do with someone when they present to you. Yep. I didn't want to be told, okay, this person has this, you got to do this. Yep. I want someone to tell me everything about them, and I'd be like, oh, okay, I see the connections between your hormonal system, your reproductive system, your digestive system, and then go with my own kind of dietary and lifestyle modifications. Yeah. And on that note, something that a clinical nutritionist can do is, especially with where I studied, very holistic. So I studied alongside acupuncturists, Chinese medicine practitioners, naturopaths. So I had a good appreciation and kind of concept of both, you know, your Western medicine and also your Eastern medicine, which is kind of, more traditional. Yep. Whereas some people, dietitians, that it's kind of fact. I don't want to sound like I'm saying people don't appreciate things, but in a hospital setting, you don't practice Chinese medicine. You don't practice alternative medicine because you've got someone with a specialized health condition, and there actually isn't enough evidence for that to be a feasible therapy.
Absolutely.
And that's just how it is.
And if we're thinking of where funding comes from and things like that, probably needing to stay more in line with where the quotation evidence is.
Yes, definitely.
For things like that.
And it's been tried and tested a lot longer. Yeah. But that doesn't go without saying, hey, I wonder if more credit was given to alternative medicine, whether or not that could be introduced and be really effective. I
agree as well, yeah.
Because I certainly believe it could be.
Yes. Is that, so in saying that, you can work in clinical populations, we've established that, but is it kind of like dietitian has more scope in their more serious health conditions where you have less error range trying to think of a better way to say that, in like the fact that you can afford to trial and error a little bit, like, do you like this much? Do you like this? What happens if we try this? What happens if we try this? Versus further down the disease progression where you have less time / freedom to go, oh, and we'll kind of see how you go on this for a while. Does it kind of require a little bit more of like a cut it down to what we know will work?
Yes.
And stick you in that. Not that either is right or wrong, but you allow, I guess, more for what someone prefers. Like you can allow for preferences rather than if you're, I don't know, whatever people that end stage cancer, it's like, no, you need this much carb, this much fat, this much protein. There's no question about it.
And I think that maybe doesn't relate so much to the extent of the disease, but maybe the environment that they're in. Once again, going back to hospitals. So they don't have time for trial and error. They've got people pumping in through their system. They're like, you need to do this right now and you need to get them out of here as quickly as possible.
Yeah, which is what we touched on before. You have more freedom with the time you spend with clients.
So I could definitely see people at, a stage of chronic disease which could be quite advanced. But obviously with the consideration of where they're at and what other health professionals are advising, if they do have the luxury of a little bit more time and they don't have to be in and out of some sort of healthcare system quickly, then I would be more than happy to work with them, and I do have the ability to work with someone like that.
That makes a lot more sense. So kind of it's more private practice versus hospital setting versus stage of disease or dietitian versus nutritionist.
And that's something as well that kind of pulled me away from the hospital system, because I want to see my clients progress. I want to have a relationship with them. I don't want to fix them and say, see you later. Who's next?
Exactly.
I want to see them go through their kind of health journey, I guess, and wherever they're at, work with them to get them back. If that takes a week or two with a little meal plan, or it takes 6 months or a year or 2 years.
Yeah, exactly. Or you just have a really long-term relationship with them where you help them through their different stages of life and their different levels of motivation and behavior change and stuff like that.
Some of my supervisors said that they saw someone during their pregnancy, and then they helped with the bub. And then that lady grew up to have her child, and he worked with them too. Like, that's just really, really cool. And that's something that I want to do. I want to have a relationship with people I see. I don't want the in and out.
I agree.
But some people do, and that's what they see themselves doing, and that's when they become a dietitian.
And you can have beneficial effects on your clients in that situation as well.
Oh, completely. You can save their life. It's only a dietitian that would know how to feed someone through like a nasogastric tube or something like that, or give them the right ratio of nutrients. And things like that. So, of course they have a place.
Absolutely.
But,
from an approach, that's kind of where it stems from.
And kind of a philosophy. I like the mind, body, soul kind of thing without sounding too airy-fairy. I do really like that. And I like giving long-term solutions with both dietary change and even lifestyle adjustments.
So I would call that a biopsychosocial model where you you appreciate all the elements of a human and how they interact.
Because I mean, from my own personal experiences, I know that food and nutrition is so much more than carbs, fat, protein, and that percentage. And that's another reason why I didn't want to work in the hospital system, because I want to understand someone's psyche around food. I want to see their social environment, how that impacts even things like who does the shopping if you're in a couple, or I don't even know, like, what leads you to reaching for this type of food over this type of food, what makes you crave KFC, like things like that. And you just don't have the time to find that in a hospital environment. Those
connections and correlations, absolutely. Because that's not your primary goal either.
No.
Like, they don't have long-term goals in those situations. It's like, deal with you now, get you okay now, and then deal with it later kind of thing.
And I mean, that's why you do sometimes see people going back into the hospital system, because short term, and then sometimes they're left on their own and they're back and they're in and out, in and out.
So that's where a relationship between the two would be really nice, where you can get your acute care somewhere, then get handed over to someone who can do more of a long-term approach with you.
Completely.
That goes exactly the same for exercise as well.
Yes.
Absolutely.
Yes.
Yeah. And we've talked, mental health management as well. We were just talking about this the other week, and like you need that person who's really experienced in acute care, because that is different, but then they need to be passed on to someone who has longer term management strategies available for them.
Completely. Yeah, totally agree. So yeah, I guess we could then go into what I offer.
Yes, please. Yes.
Well, this is so exciting. So on the topic of holistic healthcare, looking at your lifestyle, looking at your mental health, biological health, behaviors, all of that. I offer a 90-minute holistic health consult. Yes. That's what I call it.
Nice.
So that's that looks into all aspects of who you are. I go into your body systems, just some questioning about how they work. I kind of know the questions I like to ask because they're the bang for your buck ones, whereas if it's a yes or no, I'm like, okay, that indicates this, so I know where I'm going. Yep. If you're a female, I'll ask about your stress with your endocrine system, reproductive system, what your periods are like.
Yep.
Digestive system will go into like your bowel motions.
You're going to have to talk about your poo.
You're gonna have to talk about your poo. And I even have a chart for people that come see me.
I've seen it.
So get excited.
Yeah, my women's health units, we went into that and there were charts.
The descriptions are hilarious. It's like type number 3, like smooth like a sausage. And some clients find it funny, and it's great. I find it funny too.
Good.
And then things like thyroid health. So I could even ask a question like, do you experience hair loss? And if they're like, yeah, my hair's thinning, I'm like, oh, okay. Could be some sort of endocrine thyroid imbalance, hypothyroid function, things like that. And then by the kind of pictures, I guess, with all the different systems, this is where my passion is. As I was saying, I love kind of putting the pieces of the jigsaw puzzle together.
Yeah.
Like, why is this connecting to this? Okay, you're waking up really foggy in the morning and you can't get to sleep at night, and then you're skipping a period, like the cortisol linked to your reproductive system, that's going on.
Yeah.
And then, okay, your bowels are alternating, constipation, diarrhea. Oh, look at that. You're absorbing more water into your bowels at this time of the month versus this time of the month.
Yeah.
So very extensive. It takes a lot of brain power, but I love it. And then after that, I kind of go into what you eat.
Yep.
So all of my consults actually require a 5 to 7 day diet diary that you just kind of send through to me through a portal.
Yep, beforehand.
Yes, beforehand, so I can have a look at it, get a bit of an idea, kind of know what could happen before.
Yep, what the patterns are.
Yeah, so I can ask more targeted questions and get the information I want.
Yep.
So go into diet, just more detail on that, and then lifestyle, so looking at things like your work-life balance, your stress, your sleep, that's a really important one with appetite and everything, social support, mental health, all of that, and kind of with what your goals are, then put a big picture together. So a treatment plan in terms of lifestyle modifications.
Yep.
You need to swap this around with your exercise. You need to do these sleep hygiene habits, try meditation for the stress response, and then dietary adjustments. Make sure you decrease this type of amount of food. It's really good to increase this type of amount of food.
Yeah.
And then if people want to, I also offer meal plans.
Nice.
So that's just like an additional cost on top, which is planned out for you.
Nice. Yeah. And then in line with what you like eating and kind of your habits in a sense already.
So meal plans aren't my go-to, as I said, because I don't like to tell people what to eat. I like to look at their lifestyle and see where they're at and make small adjustments, because I really think slow and steady wins the race. I'm not someone to come and tell someone, well, you need to cut out this, or no bread, no pasta, no nothing.
All the people I've heard who are unhappy with their experiences are, I was told I couldn't eat this, or it was like 7 a.m., 12 o'clock and 6 p.m. and I don't eat at those times, so it doesn't work for me. Like things like that aren't tailored to them are when people don't have a good experience.
And yeah, it actually hurts how many people I've seen come in already that say, oh, well, bread, are you sure I can have bread?
I can eat rice? Pasta, you sure?
And I just lay it out to them. I'm like, what could be bad? Let me tell you what's in bread. Like, okay, unless you have celiac disease or a gluten intolerance or something like that, which I assess, it's all individualized. But how could that be bad?
Exactly.
And that's when you kind of get onto the business versus health debate, and that's what I do see a lot of corporations, like big nutrition companies which sell meal plans and all of that, they're a business. They have a kind of generalized advice that they give out. It works. If you cut out 5 types of food or 2 food groups, yeah, you're going to lose weight.
And you're going to see a difference, yeah.
Yes. And, you know, what happens when you don't have that meal plan? You go back. You buy their products. You buy their supplements.
Exactly.
It works.
Or what they offer is a short-term strategy.
Like a catch-on, like,
so
you know we're good.
you have to go back because it's not going to last you any length of time anyway.
Yeah.
Which is a good business model because you get people, you get returning customers.
Yes.
Yeah.
For sure. Whereas, yeah, I don't really have a kind of the business model that I did up was even like 4 consults on an average.
Yeah.
Kind of just the initial get to know you, maybe a meal plan in there, education, adjustments, any more questioning, and then from there, like 6 monthly reviews to see how people are going.
Yeah, and just keep them on track, and new questions will come up. And nice.
And then, back to what I offer.
Yes.
So I've got the 90-minute holistic health consult. And that, as a recap, looks into the interactions of your body systems, your lifestyle, your environment, and your diet, and how they work together to kind of contribute to any health issues they might have.
Yep.
So we don't treat the symptoms. We don't say you got a headache, let's look at the headache. We look at the underlying causes, why is this happening, and then go with diet, lifestyle, and even like supplementation to get that happening. And then got a 60-minute nutrition review consult. So that's pretty much purely diet-based, why diet might be impacting whatever issues you have.
Yep.
And that's not my preferred one to do, but I do understand that some people just want to improve their eating, whether or not that's due to sports or just generalized health, or just want to kick in the butt with getting some healthy habits going. Yeah. So that's just an hour consult, and that's when people come in. I look at their diet diary and I give them just individualized suggestions or modifications with a meal plan on top. Cool. So I wouldn't recommend that for people that have any unexplained issues or chronic health, any hormonal imbalance, because that requires a bit more depth, a bit more understanding. Absolutely. And often people come in for a 60-minute nutrition review, and then I'll ask a few questions, and in my head I'm like triggering like, oh, I need more time with you. Exactly. And I explain some things to them, and they're like, oh my gosh, I never realized that. And I'm like, hey, well, let's see how you go with these dietary adjustments. When you're ready, come back. We can do a big consult.
We can allow for more of a look into what's going on.
Yeah. Yeah. So that's
really cool.
That's kind of me.
Can you, random, I guess, question, can you send out for blood tests?
No.
Okay,
No, but I can read them.
Yes.
Okay. So unfortunately, I can send a referral to a GP.
Yes.
And be like, this is what I'm seeing in this person. There's signs of this. Yep. And then please consider this further. And it's up to them to decide whether or not they send them for testing.
Yeah, cool. All right.
Which sometimes some GPs don't like hearing from nutritionists.
Absolutely, yeah. I know from my point of view also, yeah.
Yes, so you've got to find one that works. And there are definitely people that are open to it these days, which is awesome. Yeah. I'm on a search to find one that I can work with.
Build a really good relationship with.
Yeah, definitely. Yeah. I love reviewing blood tests. It just explains a lot, and sometimes I'll get people to send me their bloods before they come in. Yeah. So you can read them. So I got a massive one recently, and I went, Abby, do you want to look at this? Yes. And I was like, yes, I love it. It's super cool to see. Yeah. But yeah, unfortunately I can't, and I have considered doing like medicine. That was my thought midway through my degree, like, oh, maybe I'll go on and do that for another 4 or 5 years so I can be a one-stop shop. Yeah.
Isn't that the dream?
So cool.
Or you can just collaborate with someone who's already spent the time and build a relationship and have a multidisciplinary team ready to go.
So that'll be something I assess whether or not I can achieve what I want to achieve with the qualifications I have. Yeah. And I will know in the next few years. And if I can't, well, guess what? I'm going back.
Absolutely. I'm already looking at my next qualification that I want.
Really?
Because you want to expand your scope, and you see where the issues are and what you're passionate about. And so if you can get qualified in those and gain access to more people, then absolutely.
I'd love to do like mental health.
See, that's, I'm looking at Masters of Counselling, and I would love to, but life. We'll see.
We shall see. I mean, there's no stop we can do that whenever we want.
Absolutely.
Yeah.
We'll see. So how can I book in with you? I'm interested. I want to a 90-minute holistic assessment because I feel like a few things are off in my life that you could help me with. How do I go about that?
Okay, so email would be the best thing to do.
Yep.
Because I'm just, once again, trying to navigate like the admin side of things. I don't want messages from all different platforms because it's hard to manage.
Absolutely.
So Abbey Renae Nutrition @gmail.com.
Great.
If you're listening to this, I've explained what I offer.
Yep.
The 90-minute holistic health or the 60-minute nutrition review.
Even just a, hey, I'm interested, and you could talk them further past that, I'm sure.
Yeah. So my hours are pretty flexible, to be honest. I work with what people want at the moment, obviously, because I'm starting out. But if and when it gets busy, then I'll obviously have appointment slots, which people will have to fit into.
Yep.
So, yeah, chuck me an email.
Nice.
Even if you're unsure of what consult you'd want, tell me what's going on.
Exactly.
And I'll say what I think.
Yep.
And you can either agree or disagree.
Nice.
But I also have a website which is in the works.
Yes.
I'm just brainstorming in my head. By the time this is released, will it be done? We shall see. It's so hard. But yeah, I'm planning on having a kind of book now little button on my website, and then it will link through to kind of an inquiry form which will be sent to my email.
Nice.
But yes, I'll post about that on my Instagram, Abbey Renae Nutrition.
Abbey Renae _nutrition.
Yes.
Yep.
Got an underscore.
Not podcast. On Instagram. Yes.
Yes. @podcast.
No.
It's getting there. It's getting there. But yes, I'll post on my Instagram as soon as that's all ready to go.
Great. You also post about this podcast on your Instagram. So for like video snippets and stuff of what we talk about.
Yes.
Abby's Instagram is a nice place to go for that.
Yeah.
Reminders to listen.
And I'm planning on my website too to have kind of like a Move Your Mind portal which shows the episodes so people can
amazing
kind of see what we're about or what I'm about, the philosophy behind what I do.
Nice.
And then a link to my Instagram.
Nice.
And then
cool.
Yes.
Sounds really good, Abbey.
Very exciting. I'm super excited.
Exactly. And we're always happy to answer questions on this podcast as well. It's less individually tailored, obviously, which is why you should go see Abbey. But happy to have this as a platform to discuss queries and questions as well.
Yeah.
If you think it's more of a broad question or want to give that a go first and then delve deeper with Abbey, that's available.
And I know we have some listeners from not in Australia.
Yes.
So I am experimenting with Zoom consultations. I've actually got one this afternoon.
Perfect.
With a friend of mine who lives in the UK.
Yeah.
So that'll be
done.
A good test.
That's nice. That, and from a business point of view, if you can increase your client base, then absolutely it makes things easier.
Yeah, that's going to be cool.
Nice.
Because I'd love to, just a different scope, a different environment.
Yeah. And it is so my exercise stuff is harder to do over telehealth.
Definitely.
But
do a squat. No, you're doing it wrong.
Something that's all talk I don't mean that in a bad way. Where you are just discussing things and then trying things. It's absolutely favourable for a Zoom consult. That's
cool.
That's
on the cards too.
Brilliant.
Yeah.
Thanks for talking to us about that, Abby.
You're very welcome.
Exciting
Thank
for
you
you.
for
I'm really excited.
Listening to me. I didn't want to talk about myself too much, and I was like, how do we open this without me being like, hey, this is me?
Let me do it. If you go to Abby's clinic, the plants you see are supplied by me. I will plug that.
Yes, it is a home clinic. I didn't even say that.
Yeah, it's a home clinic.
Northern suburbs of Perth. Western Australia.
Yeah.
My plants are great. I'm watering them
very well. Are they surviving? Good.
They look perfect.
Amazing. Well done.
And tea and coffee is supplied at my clinic too.
I've seen your videos of your system. It looks really good.
Yes.
Nice.
Maybe for some food one day. Who knows? We'll get there. Looking forward to hearing from you people.